Hello and welcome to another episode of From the Inside Out. This is actually our episode of This Week When Bust Me Up. We have Dr. Cass Nakasone here again with everybody. And of course, I'm Lehua Perry. Thank you again for joining us. Super important. If you guys like what we're doing, even if you don't like what we're doing, just please subscribe below. Press that button and press subscribe.
So family and friends, like and subscribe, please. We'll be very appreciative.
Thank you.
I'm still not sure how that works, but apparently it's supposed to be very helpful for getting the...
So we can keep doing this.
It goes higher up on the YouTube search or whatever, but I'm not sure how it
have
works.
No idea. And I don't know. Ryan says we have to subscribe, so please listen to Ryan and subscribe. Anyway, thank you. This week When Bust Me Up, we got a couple of topics to talk about.
Okay, and what are those topics? This is a very interesting one. I know you kind of gave me a little bit of a heads up.
I gave a little heads up, but I have two different ones because I have one that says, oh, sorry, Summer. I have one this week when Bust My Wallet Up, and then I have one this week when Bust Me Up. So as far as the wallet is concerned, oh, I cannot put these ears on. Anyway, I got my Disneyland shirt on and I got my Disneyland ears on. Disneyland when Bust My Wallet Up this week because we usually go to Disneyland like holidays time.
Yeah.
Do you know how much a ticket to Disneyland is?
No.
It is outrageous.
Are you talking about the air flight or just the entrance
flight,
fee? What's the entrance fee?
Flights from Hawaii during winter time, right? Crazy.
Yeah.
Then you have the entrance fee.
Which is what now?
So it depends on the day. They scale it to how busy the park is.
Okay.
And so if the park is busy, aka wintertime, then it's more expensive. And so now it goes up to $250 a ticket a day.
This is for children too?
This is for children too. Children are a little cheaper.
Little cheaper?
But it's crazy. So then you can have an option of doing a park hopper too, right? So it's not only just Disneyland, but the California Adventure behind it.
Okay.
So that's an extra park hopper.
I've never been to California Adventure. Is it a separate?
Last time you went to Disneyland?
My kids are in college now. So the last time I went to Disneyland was probably... God, gotta be 15 years ago or something, right? Or more, something
It's crazy now. So California Adventure is so much fun.
I've never been.
You gotta go.
What's that California Adventure?
Oh my gosh, such cool stuff. They have all the Guardians of the Galaxy stuff.
Oh, okay.
They have the roller racers. It's just cool stuff over there too. It's more adult on that side.
California Adventure, do they have any rides
They have alcohol.
Really?
Oh, yeah.
Do they have other rides like Avoid the Homeless? Or Watch Out for the Crack Addict? No?
Man, I got these
just was wondering.
man.
No.
Oh, okay.
But then that's another ticket you have to buy over there to go over there.
Okay.
So that's a park hopper. So that's added on another $100.
Okay.
And then when you get to Disneyland, you have to do these lightning lanes. So only certain rides you can jump to a faster lane.
It's a fast track.
Yeah.
Like the fast track ticket.
Another additional.
Cost.
Yeah. So it's $400 or $500 a day. It's crazy per person.
Wow.
So anyway.
And then you guys have a family of 4.
Yeah.
So that is...
I don't take my daughter yet though, but she's coming in. So that's another problem.
My God. So is this time with just you and...
Yeah, we always go just me and my son and my husband. Yeah. But
okay. Just because she's too young.
She's too young.
She's too young yet. And they don't appreciate it yet.
No.
I think you got to be at least, I want to say at least 5 or 6 years old for the kids to appreciate it. Because before then, they have
They don't remember either, right?
I can't even remember before I was 5 years old. Actually, to be honest, I can't really remember anything before I was 10. But so...
That's probably true.
Yeah.
Yeah. I know. It's so crazy. And then she doesn't eat mainland food, right? So she only eat local, rice, Spam, noodle,
Yeah.
So anyway, that one busts my wallet up. And then you get there, right? And then you have to have all the snacks, all the food.
Yes.
Then they have these pins to collect. You could the pins. And then these stupid ears. You can buy all the things. But you know what's so funny? As much as it costs, I love it. I love it.
I have a couple of good friends that are kind of Disney fans.
Are they fans? Yeah.
So I think they go every year.
It's so much fun, but it's just getting out of control, the price.
Yeah, I think that's true but even everything. Well, I guess right now everything is getting a little
Everything's crazy.
expensive. Yeah.
But my son says it's part of his core memories. So, you know, how you gonna
see? You see that? I tell you, that kid
core
is smart.
memory
Core memories. That's how you get to mom's heartstrings.
and
Mom,
my wallet strings, you know?
mom,
I'm gonna fork out the money.
this is part of my childhood memories.
It's my core memories, Mom. I gotta go.
Did he
You
even
know?
throw in a "Mom, I love you, Mom"? Thank you, Mom.
He's doing, we go every year and it's my core memory. That guy gets me.
That guy is
But he's
that
smart.
guy is smart.
He's smart.
Yeah.
Anyway, so that one bust my wallet up this week. Anywho, what really one bust me up this week is kind of more serious topic, I guess. It's like the only topic that kind of makes OBGYN shishi our panty.
Okay.
You know? So what happened to me was I had
For you people on the mainland, if you are watching,
sorry,
that
yeah.
means to pee in your
pee in
pants.
your pants. Sorry, I should have. Anyway, yeah. So I had a ruptured ectopic this week.
Okay.
Ruptured ectopic pregnancy this
Yeah.
week.
Well, can you tell us first of all what is an ectopic
Sure.
pregnancy?
So an ectopic pregnancy is a pregnancy that implants outside the uterus. So it's usually a regular pregnancy has to go down into your tubes and then it dunks on into the uterus.
Okay.
Somehow along that process, it doesn't do that. So it either implants in the ovary, most commonly it implants in the tube and then starts growing in your tube. All of these pregnancies aren't viable, so they will never
So
become,
you mean so they
you can't grow.
You cannot keep these pregnancies.
No.
Right? We should have
No.
a diagram of that and just show. Yeah.
I'm sorry, I
No,
should
no,
have brought
that's
a
okay.
picture.
We could add that
Let's
later.
pick one up.
Yeah, we
Yeah.
can pop one up later.
To
Just so
little
that,
anatomy.
so that people know, because I don't think people may
Yeah.
know where the uterus is and
True, and the ovaries, and,
the
it
ovaries
releases an
fallopian
egg,
tubes, yeah.
right? And then it gets fertilized, goes through the little
Yeah.
fimbria.
I
and the
always tell people it
tubes.
looks like a bull with horns.
It does. Yeah, little.
Yeah.
So, ectopic pregnancy, very not so common, but it does happen. We see it pretty often.
Like what? How often do you think it happens?
Let me
Like
get
just
that
roughly,
real. Let's see.
like 10% of pregnancies.
I'd say even less though. I don't know. It's really a small. I gotta look it up.
But
The
that's
exact
okay.
number. Sorry, but
But
anyway.
when it does happen,
Yeah, mostly in the
um,
tube.
if they do have an ectopic pregnancy, you're saying that definitely they cannot. Obviously, you cannot carry this to term, right?
No.
So what do you guys have to do?
So you can do like three things. Well, there's some risk factors,
Okay.
of course, right? That kind of.
What are those risk factors?
So the risk factors are previous history of ectopic. So if you had an ectopic,
Okay.
you're at risk of having it again.
Okay.
Any history of like chlamydia, gonorrhea, any infection of the pelvis.
Okay.
Little known
That
fact.
has to be active, or you've even
No,
if you've
even
had
if you've had it.
So that makes sense, right? Because then you have maybe some scarring
Scarring.
within the fallopian tube, so
Exactly.
the travel of the egg down the tube
Yes.
is not smooth, or it gets caught on something, or
Correct.
whatever, right?
Yeah. A little known fact, the tube actually has little cilia in it. Like,
That
our
move,
nose.
yes,
Yeah.
yes.
So it moves these,
That's right. I remember some
Pregnancy
things
down.
from medical school.
Yeah.
Okay.
So sometimes with the chlamydia, gonorrhea, even smoking, those cilia are blunted.
So
And
their
you can get
activity
scar-
is less, so
less.
they're less efficient at moving the egg down the
Correct.
tube.
Yes. But it could also be in the ovary. It could be other places
Got it.
too. But those are some risk factors. Endometriosis, IUDs. So if you have
So-
an IUD,
So actually, this is kind of it's all makes sense, right? Because all
Yeah.
of those things promote inflammation
yes.
within the uterus
Yes.
or somewhere within that area. right?
Yes.
So it
yes.
could, whether your body's, I mean, even though the IUD's technically in your cervix, right?
It's in your uterus. So the intrauterine device stays in the uterus.
Isn't it?
It's up
stick-
inside.
Oh, it is. It's not. I
Uh-huh.
thought it was upside down into the cervix.
Oh no! So we go through the cervix into the uterus,
Oh, okay.
and then it kind of sits
So
there
it,
like a little T.
so it
in
does
there.
irritate the lining, and it does cause
Sterile
inflammation.
inflammation. That's
Yeah,
its
sterile inflammation. right?
mechanism of
Yeah.
action. Yeah, and so it just increases the chance that it doesn't implant correctly into the
Mm.
uterus. So IUDs, there is a little bit more
Yeah.
a higher
So
risk of
I'm
ectopic.
guessing people who have like rheumatoid arthritis, lupus, do they have higher incidences of of ectopic
I would think
pregnancies?
so.
Right?
I don't
You
know
would think,
exactly,
right?
but you would think
Yeah,
so.
any kind of autoimmune inflammatory.
Anything that has, I guess so. Yeah.
Hmm.
So
That's
those are
interesting.
some
Okay.
risk factors of that.
Yeah,
And then ectopic pregnancy is like 1 to 2% of all pregnancies. So it's kind of low.
It's kind
But
of
we do see it.
Yeah.
And then when it does happen, it can be super dangerous. So that's why we worry. Because we worry not only if you just have an ectopic, but if that ectopic eventually ruptures or grows big enough where your tube kind of bursts open.
Yeah. Okay, so how far, well, first of all, if you have an ectopic pregnancy, what are the symptoms? Because this is something that can kill somebody,
It
right?
can. And
So-
very quickly too.
So what kind
if it
of,
ruptures. But
yeah,
the regular ectopic, usually we have some time.
okay, so how does a woman know that she's having an ectopic pregnancy? Like, what are the symptoms?
So it's hard because the first thing that women do is we get a pregnancy test and then
Okay.
we say, oh, it's positive.
Okay.
And then we go to the OBGYN about 6 weeks out.
Okay.
OBGYNs, we usually will do ultrasound in the office.
Okay.
Sometimes, though, we would expect to see at about 6 weeks, we'd expect to see something in the uterus, sac or,
Sure.
fetal pole, yolk sac, these things that
The
kind
beginning of the
become-
baby.
Right. Even a fetus with a heartbeat,
Yeah.
sometimes we'll see that. But with an ectopic pregnancy, if we put the ultrasound in and we see an empty uterus, but we have a positive pregnancy, that's automatically a pregnancy of unknown location. So
Okay.
we don't know. If we don't see it in the uterus, we don't know where it is.
Which is what ectopic means, right?
Yeah,
It means wrong location.
Exactly.
Yeah.
So at that point, we'd have to get a pregnancy hormone called a beta HCG.
Okay.
We call it a beta quant. So we can quantify how high or low your pregnancy hormone is. And then we have to kind of trend those hormones over the next 48 hours.
Okay.
Usually by 48 hours, they should double. We should see a doubling. It doesn't mean, though, that it's necessarily a normal pregnancy if it doubles. It just means that there's something in the pelvis that's growing.
Okay.
So if it keeps on going up, if our pregnancy hormone keeps going up, but we don't see anything in the uterus, eventually we would send you for a formal ultrasound or an ultrasound that we can kind of see exactly where the pregnancy may be eventually. Usually they present around 6 to 9 weeks.
So you don't use MRIs to...
No, just ultrasound.
Just ultrasound.
Mhm.
Okay. And like, so most of the times these diagnoses are made by the OBGYN if the woman is coming in for a check, like let's say she says, oh, I missed my period for this month. I'm worried that I might be pregnant, or they take a home pregnancy test.
Yeah.
They're pregnant, they go in to get checked.
Mhm.
The danger is those women who
Don't come in.
who don't know they're pregnant,
Yes.
or who have other social problems like drugs,
Right.
where they know they're pregnant, but they're on drugs, so they don't come in.
Yeah.
What kinds of symptoms might they have?
So-
Like, do they have abdominal pain?
Abdominal pain and bleeding are the two most common things.
Oh, okay.
So you'll have abdominal pain and some bleeding, and then we would do an ultrasound.
Okay.
Nothing in the uterus, but we'll see something in the tube or an ovary, and very rarely you can have something called a heterotopic pregnancy, which
Okay.
is one in the tube or the ovary or somewhere outside the uterus,
Okay.
and one in the uterus. So you could have a double pregnancy, an ectopic and a regular at the same time. Sometimes
Wow.
it's very rare, but I've seen that too.
So, okay, so let's say you do diagnose the ectopic
Yeah.
pregnancy. Now what?
So we have 3 things we can do.
Yeah, what-
Kind of depends on a lot of factors.
Okay.
But if you're stable, if your pregnancy hormone is a certain level,
Okay.
you might be a candidate for different things. So we usually will counsel somebody if they're very reliable.
Yep.
We can do either expectant management, meaning if the quants are going down,
Yeah.
and they're stable and they're in no pain, they're no bleeding,
Yeah.
we can kind of watch it. Most likely, though, we would offer them something called methotrexate, which is a shot.
Okay.
It's actually a chemotherapy agent.
Yeah, it is. Oh, it's an anti-rheumatic agent.
Yeah.
Yeah.
Oh, that's right.
Yeah, they use it
Yeah,
for
that's it.
to help control rheumatoid arthritis or
right.
other autoimmune
Yes.
diseases. But
So it'll attack replicating DNA, basically.
so basically, it's you're basically doing a chemical abortion.
Yes.
Right.
So it'll
Chemical
attack
abortion.
anything that's kind of replicating rapidly.
Okay.
this methotrexate, there are certain people who aren't candidates for it. There are certain people who
Okay.
are, and you have to watch them very, very closely still.
What happens if, say, you have that woman who didn't know she was pregnant? She's ignoring the abdominal pain.
Yeah.
I'm assuming this is kind of what happened with your case.
A lot of times it does, where you just, you have pain,
So
but
let's say they come in late.
yeah.
Maybe let's say we're talking about maybe 2.5 months,
Yeah. Yeah.
right? The fetus is getting quite a bit larger.
Mm-hmm.
It's stuck in the fallopian tube.
Mm-hmm.
What do you guys have to do? I'm guessing you have to do surgery.
So if, like I said, if you don't meet the criteria for the methotrexate
Okay.
and you're in pain and it's just your vital signs are not stable, we have to take you to surgery. And
Okay.
so those are some things that we just take you straight to surgery for. And then we have to take the tube out, or we kind of open the tube and remove the pregnancy out of the tube.
Okay.
So it's called a salpingectomy,
Okay.
which is taking the tube out, or a salpingostomy, where we open the tube.
Oh, okay.
And then we sometimes can just kind of blow some water through it and kind of remove it.
Yeah.
You know.
Yep.
So it kind of depends
On how large it is.
on how large it is and if it's actually ruptured and there's no saving that tube.
So what happened in your case this time?
So my case, she had a ectopic pregnancy, but was seen elsewhere. She went to the ER for abdominal pain, but they didn't see anything in the uterus. And apparently she tried to have the pregnancy chemically aborted already elsewhere.
Okay.
And it didn't work. But she didn't know if she had diverticulitis or if she had abdominal pain, like lower abdominal pain.
Sure.
So it was kind of hard to tell.
Okay.
But the ultrasound said that there was nothing seen in the tube, in the ovary, in the uterus, and the pregnancy hormone was still elevated. So it was kind of weird. I saw her back in the office, and then we sent her for another ultrasound at somewhere else where, they're very good.
Okay.
Shout out to Malama Imaging. They're really great because they're two OBGYNs. They know what they're doing.
Oh, okay. So I'm sorry. So Malama Imaging, they do specifically
They do
ultrasounds?
ultrasounds, but they're two OBGYNs, and now they just specialize in ultrasound. That's all they do for OBGYN stuff.
That's excellent.
And so they're so great. And so they found the ectopic for me. Yeah.
Okay.
And then because she was she was in so much pain.
Yeah.
And she already had that failed, attempt at aborting the pregnancy. We took her back for surgery immediately.
Okay.
Yeah. Because there's really no telling when these things rupture. And it doesn't matter on
That's what's scary, though.
quant. So you can have a really high quant and some people won't rupture at all.
Yeah.
And you can I've had somebody rupture at 300, where you could be as high as 16,000.
So I think what you're talking about is that the tube, the fallopian tube where the baby is growing or the fetus is growing, can actually explode.
It
right?
can
So
explode.
It'll break and
The
it'll
ovary
cause
too.
a lot of bleeding.
It'll cause tons of bleeding, and then your belly will be filled with blood.
Yeah, and I think this is one lesson when I was doing my general surgery residency.
Yeah.
The sickest people in the ICU that I saw were OBGYN infections of the uterus or some problem to the uterus because it's so vascular.
It's so vascular.
So you were telling me about how much a uterus can bleed per minute. What did you say?
So it pumps around 600 mLs a minute. So almost a liter of, like a pregnant uterus pumps almost a liter of blood a minute.
So
That's
if that
unreal.
ruptures, you
It
can
goes
die
so
like that.
fast,
And that's why these ectopic
are so
ruptures
dangerous.
So dangerous, right? Because women can just bleed out.
Real quick.
Yeah,
And
that is
like
scary.
in front of our eyes, So that's why it's such a scary thing.
Yeah.
We take ectopic pregnancies very seriously,
yeah.
but then we take, when it ruptures, that's an emergent.
Yeah, because it's
surgery.
almost like a ruptured major vessel.
It's
Yeah, right.
And your belly can fill with blood really, really quickly.
I've seen, the worst patients I've seen were these young, otherwise healthy women
Yeah.
that had something and then they get an infection in their uterus. And then because there's so much blood flow, they just get septic. Their whole body
their
gets
whole
septic.
body, yep.
And that infection spreads all
So
over,
fast.
and they have multi-organ system failure, and they are in the ICU like this close to dying. That's my new kitty, by the way.
What is he doing?
I have no idea. He just wanted to get into the action, I guess. But yeah, it is a very
It's a very scary thing.
yeah, so everything turned out okay.
Okay, we took a tube out. Everything was good. She's doing much better. Like
that's good.
immediate relief.
Yeah.
And then you clear out all of that blood because the blood is very irritating in the belly. So
Yes.
when it ruptures, you have just acute pain.
Yeah.
Super sore, usually on one side
Yeah,
more
it's
than the
interesting
other.
that blood is a very painful or
is.
inflammatory inciting substance,
Yeah.
even in joints. So when you like we'll have people who have let's say you had a knee replacement.
But joints aren't really vascular, right? Or
No,
are
but
they?
you do well. They're
They
not
have a
really
little
vascular, but obviously you're gonna
Supply.
have some blood flow to your knee, right? But let's say you have a guy who's on who had a knee replacement, and and
Today
say
is just something else, yeah.
And say he has to be on some kind of anticoagulant for another condition like a heart problem. So he's on a blood thinner.
Okay.
These people can be doing just fine,
Yeah.
walking around, doing whatever, just shopping at Costco.
And then
they might just have spontaneous bleeding into their joint because they're on the blood thinner.
that's crazy.
Right?
Yeah.
And it is super painful. Like
Is it?
it acts like it's almost like a septic joint, right?
Wow.
But when you aspirate, it's all blood.
It's all blood.
It's all blood, and blood is very irritating to
But
the
in
joints.
the joint, does it kind of tamponade itself or
It
stop
kind
the
of
bleeding
does,
itself?
but it gets super tight like a balloon, right?
Like almost like a compartment syndrome? That's
but
going back
not,
to
yeah, but
med school.
not the same because it's not really your muscle, right? It's just that
That's true.
your knee capsule
It's
is
just
so
so
strong, and it's just filling with blood,
Ugh.
and it's like a balloon,
Yeah.
right? So it's your knee becomes all tight and swollen, and the blood is extra irritating.
It's super irritating.
It's not like just like you have a synovial fluid from say a meniscal tear, and you have fluid in your knee. Blood seems to be extra
More
irritating.
irritating.
Yeah, it causes a lot
Same
of pain.
thing with like ruptured cysts. Some ladies have
But I
cysts
guess
that rupture.
I guess that
Same
makes sense,
thing.
right? That must be a what do you call a protective
I
evolutionary
guess so.
reaction, because if you're bleeding in your body,
It's like a
you
heightened.
better know, right? It better alarm you very quickly because But I guess,
to let you know there's something really wrong. So.
but I mean, I'm thinking, gee, before we had medicine, people would just have this incredible pain and then die.
And then
right?
because what can you do,
You can't do
right?
anything, yeah.
But it's just so dangerous, these things, and it can go from 0 to 60 so fast.
Well, I'm glad that patient
Me too.
ended up being.
It's very sweet.
Yeah, I'm glad nothing else happened, right?
Me
Because these
too.
things can. Yeah, those are the scariest patients.
They're
that I've seen.
super scary, and all of these ectopics that I usually have, I don't know for whatever reason, they usually buckle loose at 2 to 3 a.m. It's very rare they do this at during the daytime when everybody.
Yeah.
This one was during the daytime, but
I think that's another thing that
I don't know why. It's
for
almost like
for
at the
people out
wrong
there
hour.
for patients or people listening who are not in the medical field, it is a weird thing. Bad things always happen when it is the most inconvenient time of the day.
Always.
Right? If I was in surgery and I'm already in surgery and say something happens, well, that's easy.
Yeah, you're like, okay, we're here.
Let's just add this patient on. We'll get it fixed. Blah blah blah. But it always happens at 2 a.m. Right? Somebody right. This
one happened at 10. And then, just for patients out there, we don't like canceling on our whole clinic, but our whole day is done, right?
Yep.
So once somebody comes in with an emergency like that, we have to cancel our whole day of clinic. So 30, 40 patients, we have to call, reschedule, but we're, in the OR. So it's a hard thing.
Yeah, this is another thing that I think I would like people to understand. This doesn't happen in orthopedics, obviously, because we don't have those kinds of life and death emergencies. But for people like you, OBGYNs, vascular surgeons, cardiovascular surgeons,
even urologists,
any other general surgeons are worse. Just imagine you have clinic all day on Wednesday.
All day.
You're on call Tuesday night.
Yep.
Tuesday at 1 o'clock, you
Something
have a
comes in.
ruptured something,
Yep.
you got to go into the OR, operate all night,
Mhm.
and then they expect you to go straight to clinic
Yes.
and see your
That's
30
the same
or
thing with
40 patients.
C-sections, right? We
Yeah.
do that all the time.
But I think so. And, patients, they may be upset that, oh my
They're
God,
upset.
my
Understandably so.
yeah, understandably so.
But
I think,
I had to cancel my work to be here. And,
yes.
I get it.
And, it is an inconvenience for everybody, but I think patients should understand that it's not like the doctor was futzing around all night getting drunk. You know what I mean?
No.
Like the poor cardiovascular surgeons, right? Like they're up all night, or the vascular surgeons doing whatever.
They have a
aneurysm.
long ones too. Yeah.
And these guys, you got to be tough as nails. That's why people may disagree with me about this sentiment, but I always feel like residencies used to be very tough,
They are tough.
right?
Yeah.
There was no such thing as rest.
No.
And now we have these 80-hour
Work
minimum work
week.
weeks. Now, they've instituted that for safety reasons.
Yeah.
But when you think about it, like when I was a resident, I was literally physically in the hospital 126 hours a week.
About
And
120
there's
hours.
only 140 hours a week,
Yeah.
right? In the
I
hours in a
don't know.
week.
I think so.
Yeah,
Yeah.
it's crazy.
Mm-hmm.
But it's like a hazing program. I mean,
It
you
is.
have to be tough.
You have to be tough.
You have to be tough. Like I
Mhm.
remember, and this is probably, not so PC. But I remember when I was a resident, we had some other residents. I remember one resident like literally coming to me crying, like, "Oh my God, I don't know if I can handle this anymore."
Oh,
And,
what would they say, right? Save
well-
your tears for your pillow.
well, what I wanted to
That's
tell,
what they told us.
well, that's what I wanted to tell him. I was
Yeah.
like, "Hey, then quit."
Yeah. Or
Right?
they say there's
'Cause
a
this is-
stairwell.
this
Go
is-
cry in the stairwell and then come back when you pop.
Yeah, like this is not the job for you,
Yeah.
right?
Yeah.
I mean, I'm sorry you were up all night and you got to work again today, but
Uh-huh.
But- because if it was you,
Yeah.
and say your mom has a aneurysm in the middle of the night,
Right.
is that what you want your doctor to be like? To call the ER to call up your neurosurgeon, and he's like, "Oh, I'm so tired and I worked all day already today. I can't come
Right.
in. Why is this happening now?" You gotta
It's
have
just
that.
like medicine's changing so much.
Yeah, but you
know?
gotta you just have to be that way, or you should find another job,
Yeah.
right?
Yeah.
Like
There's not fun parts to our job.
yeah,
you
it's
know?
like I would say orthopedics were pretty lucky, but the trauma guys, for example,
Yeah, the
right?
trauma guys. Oh, they work
They gotta
hard.
work.
Or like when you guys have the multiple traumas, like
Yeah,
that's
like those guys. But the real like what you guys do with the heart surgeons, the vascular surgeons, the urologists, general surgeons, right?
Yeah.
I mean, I have the greatest respect for those guys because
it's 24/7.
it's 24/7. Like they,
Yeah.
I mean,
And we got to be ready for anything. You could be at birthday
Yeah.
party. You could be at
Yeah.
your
And there's
kid's
no-
basketball
you know,
game.
like, what is that show? There's no crying in baseball.
There's no crying in baseball.
There's no crying in surgery.
You put your big girl panties on
That's right.
and you go.
Yep.
And it just hope for the best and do your
Yeah,
best.
you have to. What else can
And-
you do, right?
yep,
You
but
gotta
then-
you gotta wake up and you gotta
Yep.
be ready.
And then 4 or 5 a.m. you're pow, and then you have some breakfast. You have a little coffee,
Yep.
take a little cat nap, and you're good to go all day for clinic.
Yep.
But that's the way it goes.
That's
you
the
know,
way it
I
goes.
think a lot of people don't understand.
Yeah. Well, I don't think
That
you.
part.
Yeah. I think people don't appreciate that. So
Yeah.
sometimes, I've been very lucky. My patients have all been so gracious. Like if I explain to them that, hey, this came up,
Mhm.
something happened with this, and they're usually very
Really
I've
nice.
but Hawaii people are so
The Hawaii
nice.
people are so
Yeah, Hawaii
sweet.
people are so
Mhm.
good. So I think
But there are those people who I feel horrible for because it just keeps happening to that one
Yeah.
person, right? Where you have an emergency and then reschedule and then another emergency, another day.
Yeah,
And then,
we
oh
had,
my gosh, I'm so sorry.
I remember some patients were just like that, where some kind of instrument thing happened, like the sterilization wasn't proper.
Yeah.
So we had to cancel the case. And then the next time something else
Something
happened.
else happened.
But I always
Same
explain
person,
to them.
right?
I always explain to them from a
I feel so horrible in that.
I feel so horrible, but I always explain to them that maybe this is
A
sometimes
sign.
the universe is telling us that this is not the right
Totally
time.
agree.
And let's just go with the flow.
Yep.
Let's just appreciate that we caught these things.
Yes.
And let's do the best we can to
Yep.
get you as safely, get this done
Get
as
this
safely
safely
and
as
as
possible.
done as properly as
Yes.
possible. Yeah.
Everything happens for a reason.
Everything does.
I feel.
I hate to sound sort of superstitious
Oh.
as a surgeon,
I am though.
but I think all surgeons are like
Even down to my underwear. Do you know that?
Oh, I don't-
I
I
have
don't have
bad
any.
luck underwear. Do you have bad luck?
No, I don't. I haven't noticed any bad luck underwear for me personally.
Bad luck. I don't know if I'm the only OB out there, but if I wear certain things,
Yeah.
bad things happen.
No,
and
I
that's
haven't
it
noticed.
with ruptured ectopic. It wasn't underwear, but I had a new pair of shoes.
Okay.
And then I was like, oh, I never wear these black shoes. Let me wear these black. And I never do that. In every section, I wear these ugly shoes and everything's good. And I have the same things. I
Yeah.
wore black shoes that day.
Yeah.
But see, I don't know. It's just superstitious stuff that
Yeah.
we do.
But I think, we say that, but that's probably because when you change, like surgeons
when you
are very,
change, we're
surgeons
very,
are very protocol.
we have very,
Yeah. And I think that is why, this brings up another topic, why I don't get nervous, but it always makes me think when I have to operate on a surgeon
Mhm.
or another doctor
Mhm.
or a physician's family member.
Mm.
Like, I swear to God, I don't know if those are the ones that just stick in your mind,
Oh, I get
But-
nervous.
but
every
something
time.
weird always happens. And my suspicion is that, especially if you're working on a doctor,
Mhm.
right? The doctors will always say like, oh, well, what medicine are you going to give me? Oh, no, I don't want to take that. Let's change it to this. And they start messing with the protocols that you have set up,
That's
right? Because
true.
they think, oh, I'm a doctor.
Mhm.
I don't want to take, I don't want this medication. I want to go with this because I think I'm more comfortable taking this,
Mhm,
right?
mhm.
And
So it
this-
messes up your
well, it changes
style a little bit.
It changes something in the algorithm of what's happening after surgery, I think.
Yeah.
Like husbands, very, or wives, right? Doctor, they're like, oh, I don't think my husband should get that tranexamic acid, before surgery. He had a history of this and blah, blah, blah. And we're like, well, it's not going to affect it.
Same
Oh,
with
yeah.
surgery.
I did it for everyone. And I'm very aggressive with it because it really, like, we've published studies showing that it really
We use it for
reduced-
C-section,
Oh, it for joint replacements, it is, for us, it's been like,
really
oh,
helps with the
absolutely.
blood loss.
Yeah, like I mean, our
Sorry,
Our-
that's a tangent.
tangent,
But that's
but
all right.
no, but our blood loss or transfusion rate
Yeah.
after joint replacements
Yeah.
is one of the lowest in the nation. So
What?
yeah, I don't think it's just the
But you guys do
TXA,
it prophylactically, yeah.
we do it prophylactically.
See, we did a study
Yeah.
where we were kind of doing studies about giving TXA prior to C-section.
Yeah.
I don't know what the outcome was, but
Oh,
if they have a real risk, we give it.
oh, I do. So we give usually 1 gram before incision,
Uh-huh.
and we usually give 1 gram right before closure.
Oh.
So 2 grams.
Do you give 2 grams?
Yep.
Wow.
And as far as the orthopedics surgery literature, it's very safe, even if you've had history of clots and stuff. So
Really?
but sometimes the anesthesiologist may not be comfortable if they feel,
True.
but I'm very aggressive with it. I think.
Wow. And you never had like
No,
adverse outcomes, huh?
yeah, I mean, not from that. I mean, it's really
But
mean,
now
I
it's just standard protocol.
we've had this protocol for
That's
years.
interesting. Anyway, but yeah, I feel like that is very, as surgeons, we have a very
Yeah, a very
regimented thing that we do, down to the way we tie our mask, I'm sure, right?
Yeah, that's true.
And the way we like our
Yep.
our booties tied.
Yep.
Yeah.
Yeah.
I like my bun high, like a big
Yep.
blueberry on my head, a big doodle bun, so my hat goes up. Like you have your thing.
Yeah.
So it's really
Yeah, that's true.
But anyway, so that's this week when busts me up. But all's well that ends well, I guess.
Yeah. So stay tuned. Today we have our second episode, or our next episode. We're going to be speaking with Chip Yamaguchi, co-owner of Stay Fit Physical Therapy, who does a lot of post-operative physical therapy for all sorts of, obviously, musculoskeletal disorders. But in particular, we've had a close relationship with our orthopedic department, looking at post-operative hip and knee replacements, and also like shoulder therapy, et cetera, et cetera. So we'll have him on as our next guest, and we'll introduce him here as soon as we can. But thank you for joining us. And don't forget to like and subscribe. They said that really helps us, so we appreciate it if you guys would do that. And stay tuned for the next episode.
Thanks.